Julian. I am going to very briefly offer a review of our work this morning. As you can see, we are connected to Zoom, and we are requesting that participants be kind enough to begin identifying themselves with the first three letters of the country they represent. And what you do is that you rename yourself. And if you need to ask for the floor, you can use the electronic icon to raise your hand. We'd also like to inform you that we are offering interpretation. You will see the globe, the international globe, wherein you have a list of the languages offered, and you can click on the one which you wish to follow. We are pleased to give you the floor once we will see your electronic hand raised, and we'll also have question and answers. So if you have a question, you can certainly include it on the icon that says Q&A. Thank you very much. Thank you very much, Georgia Jet. We appreciate that intro, and a good morning to you all. We don't have a huge audience, but I still believe that it is worthwhile, certainly to seize the opportunity and to move forward with the presentation. And we have the recordings going so that as and when other colleagues join us, we will be happy to welcome them. But we have a 30-minute presentation. It is a long presentation, which of course focuses on an update on the WHO guidance for COVID-19 public health surveillance. So we'll be following that with a general discussion. So as not to waste any time at all, let me simply say how pleased we are to have you with us. And I'm happy to give the floor now to Dr. Vicari, who will be offering a few welcoming remarks by way of introduction. And our colleague Lydia Redondo will be intervening right after that. So warm greetings to you all. Thank you very much, Angel, says Dr. Vicari, and greetings to each of you who is already joining us. We appreciate your interest in coming to this international seminar on an update on our COVID-19 epidemiological surveillance. We are in a period of transition. The response to COVID is one thing. The pandemic itself posed its own challenges, but I believe that it's critical that we recognize that we are still living in the pandemic. Some would suggest otherwise, but I believe we all would agree. And from a regional level, it's critical indeed also that we make sure we adapt as needed and ensure that we're making the systems as sustainable and resilient as possible. We will obviously always have to update our work as we go. And this, I believe, will be a fine moment for us to put our heads together and see what we can do to ensure that the situation for each of us is as sustainable as possible. COVID-19 isn't going to go away. The Omicron variants are what they are, as well as the other variants. And I think everybody understands that this is something we'll have to live with and be smart about. So I want to thank each and every one of you for your efforts. I know that we all feel rushed off our feet, and I am very grateful, therefore, that you're taking the time to join us, all of you from your respective ministries of health, your representatives of public health in your respective countries. We know how busy your agendas are, and we're deeply grateful to you for taking the time to be with us today. I hope you find the seminar enlightening. Thank you, Andrea, for your kind words. Let us then jump right into the presentation. Leon, go right ahead. Well, thank you, Angel. Let me simply confirm that you can see the presentation. I hope that is clear to everyone. Yes, I believe it is, says Andrea. Right, well, thank you very much. I'm Lidia Redondo of the influenza and other respiratory ailments and infectious diseases here at Bajo, and I will make a presentation here on public health surveillance for COVID-19 on behalf of my overall team. So here we go. This updated interim guidance will replace the one that was published on the 14th of February of 2022. As you can see, this new one that I am presenting today was published not a month ago, July 22nd. And here are the key points. First of all, let us be very clear as to the differentiation that we must understand as to what might be core surveillance objectives, which must be maintained and strengthened on the one hand, and also other objectives that are part of a surveillance that is not as specific and that is recommended to those member states, enhanced surveillance that is recommended to member states according to their respective capacity. The idea, above all, is that we have a very good early warning for changes in epidemiological patterns, monitoring trends in morbidity and mortality, monitoring burden of disease on healthcare capacity, and finally, incorporating strategic and geographically representative genomic surveillance in order to monitor circulation of known variants of concern and allow for early detection of new variants of concern, circulation of SARS-CoV-2 in potential animal reservoirs, and changes in virological patterns. On the other hand, in terms of enhanced surveillance, as I mentioned briefly a minute ago, which is recommended to member states according to their respective capacity, this is critical in describing and monitoring infection in high-risk groups and continue to be at the highest risk of exposure or severe disease, characterizing new variants as they may appear, better understanding post-COVID-19 condition called long COVID, including the role of immunity and associated risk factors. And finally, but as they say, last but not least, to estimate vaccine effectiveness and the level that it is available in the general population. Now, the updated interim guidance in view of the key points I just mentioned is to ensure that we maintain a routine syndromic surveillance for other infectious diseases, especially those caused by respiratory pathogens, such as influenza and respiratory syncytial virus, influenza-like illness, severe acute respiratory infections, and acute respiratory infections in general. Why? Because as Dr. Vicardi said a minute ago, we're thinking of a level of surveillance that we can hope will be more effective and more broadly available. But we cannot, of course, forget the importance of having universal national reporting of clusters of unusual or unexplained respiratory syndromes, which is absolutely vital. So we need to aim, you understand, for both types of surveillance. It isn't one or the other. We need both to have a critical understanding of the trends and the other diseases that are making themselves clear and that are necessary to bear in mind in clinical management. Therefore, under this updated interim guidance, we're looking at the public health surveillance for COVID-19 and want to highlight what's new. An update of case definition, an update of contact definitions. We are also especially mentioning various variants and the genomic surveillance, the surveillance of those variants and testing strategies, update of core surveillance methods, but finally an update of COVID-19 surveillance as to reporting requirements to WHO and to PAHO, of course, as well. So let's begin, as I go over that purview, with an updating of the interim guidance. The public health surveillance for COVID-19 doesn't have at this moment any great changes in the clinical criteria. We're just saying ILI, as we have been speaking in terms of the terminology of the integrated surveillance of the G, and we are simplifying the epidemiological criteria, a contact of a probable or confirmed case or that is linked to a COVID-19 cluster. Whereas at the beginning, we were looking at acute onset of fever and cough. We see here the mention of acute respiratory infection, the SARI, and finally, that this is a novelty, this is new, we mention a person who may not yet show clinical signs or symptoms or meets epidemiological criteria, however, that has a positive professional use or self-test SARS-CoV-2 antigen testing. That is something new. As to a probable case of SARS-CoV-2 infection, you have two options. One has to do with the C and D. Those have changed, but the first two criteria are the same. That is, a patient who meets clinical criteria and is a contact of a probable or confirmed case or linked to COVID-19 cluster, or B, there's a death not otherwise explained in an adult with respiratory distress preceding death, and who was a contact of a probable or confirmed case or a linked to a COVID-19 cluster. And finally, as to a confirmed case, because what I just mentioned was a probable case on the left, but here we're looking at confirmed cases. The first is a nucleic acid amplification test, the NAT, and B, a person with meeting clinical criteria and or epidemiological criteria with a positive professional use or self-test. Drilling down into the contact definition, not much has changed, but in terms of exposure, we are considering that exposure to a symptomatic case will be 2 days before and 10 days after the symptom onset. That's the same as before, plus 3 days without symptoms or 3 days with improving symptoms, we're now saying. Therefore, the minimum period is a minimum of 13 days as before, but we're slicing it differently. You've got 3 days without symptoms, 3 days improving symptoms. And finally, with regard to the contact definition, here we have sought to define very clearly what the priority groups would be: people that have a higher chance of developing severe disease if infected through a contact case, as well as those persons who are unvaccinated or partially vaccinated, especially if they happen to belong to the above high-risk groups. Then also, the priority settings go on to spell out that we're talking about environments where there's a higher chance that people belonging to the priority groups might stay for extended periods of time in close proximity with each other, and priority situations that we now see as circumstances such as the emergence of a new variant, for which characteristics of immune escape and disease severity are as yet unknown. Once we have taken into account all of this, both in terms of the update and the context, we are looking at the recommended COVID-19 elements in these different chapters. First of all, core surveillance, essential surveillance, as I mentioned earlier, there where these points not only must be maintained, but strengthened if needed. Here we go. If we take it objective by objective, beginning with early warning, it is of extreme importance that the early warning system strikes a balance between sensitivity and specificity. Sensitivity to any signal indicative of increased risk, like transmissibility and or severity. Specificity, that is investigation for additional evidence to confirm the risk, and the shortest time frame possible between the detection of the signal on the one hand and confirmation or dismissal of the alert on the other. Now, to that end, we need a triangulation of signal resources and a strong rapid response, and investigation resources and procedures, as well, of course, with coordination of the stakeholders. Now, here you see an overview of the various methods that need to be considered in order to proceed to these different elements. There's a long list here. There's no need to tick off every one of them, but you want to be sure what everyone is and how they apply to you. Here you have the Sentinel. Many of the countries in our region have this G element. It's important to have an early warning system, and the first signs of these issues and we might be able to identify all of these alerts in other contexts: mandatory notifiable disease, screening and reporting, cluster investigations, community-based surveillance and environmental surveillance, and pharmaceutical vigilance. That also can be extremely useful given the different systems.
When we speak about the monitoring of trends in morbidity and mortality, which was the second objective of this essential or core surveillance, we have wanted to emphasize that which can be adapted within the context of our region. In order to conduct this monitoring of trends of mortality and morbidity, sentinel surveillance may apply very well. And those centers which have primary healthcare, or those hospitals which are part of the sentinel surveillance, may help us, if they're sufficiently reinforced, to find the various indicators which are herein proposed, not just regarding morbidity, but also mortality. And this might be helpful, as we will see next, to assess trends as regards sanitary activities. Also, we have what has been developed throughout the pandemic, which is the assessment and monitoring of deaths through different causes, or those that can be attributed to COVID-19, which are part of civil registration and vital statistics. These examples that we show of various options which serve to be adapted to the context in the region have been obtained from the expert consultation conducted in Panama toward the end of March, which has contributed to the updating of this guide. So the main objective to conduct this trend monitoring is to produce time series that are stable with those epidemiological indicators that allow us to assess any change in the patterns that we have been observing. So these have to be stable, regular series that will give a reliance and confidence in their interpretations of those countries that have already developed a robust sentinel surveillance, or who might have to strengthen it. This might be one of their main options in order to conduct this monitoring. With regard to the occupation of health facilities and its capabilities, various indicators have been proposed: absenteeism among healthcare workers, the percentage of beds which are occupied or available for treatment of COVID-19, as well as oxygen supply. We want to emphasize here the very same message. We must bear in mind that many of the countries in our region have a sentinel SARI, which is made up by the primary care center, the hospitals, and therefore the efforts could focus in obtaining the information at those centers in order to have a surveillance system that is more efficient. As regards the actual objective of the genomic surveillance, we must speak about the importance of strategies that were mentioned already with regard to genomic surveillance in WHO. But as an update of this guide, we try to bring in also routine surveillance. So we must establish a differentiation between the two main strategies. On the one hand, that which is based on a randomized sampling, which is representative, with the selection of a subset of samples of an average population of which we want it to be representative, and how this must be part of the routine surveillance, clear methodology and flow of information that will also be clear and well established. The strategy, which is geared or directed, is that which is focused in order to be able to detect those new variants. We do account with the samples that must have or could have a pre-test larger in order to become a test of interest or concern. Here you see many of these examples. Once again, we emphasize the importance of bringing in, especially in routine representative sampling, and some of the cases that might be detected for this targeted together with the Sentinel SARI, and something which was highlighted in the meeting of experts, which is very relevant to conduct genomic surveillance, which is linked to the human-animal interface as part of the routine surveillance and also as part of the targeted surveillance. But samples must all be taken in those unusual clusters as well as in those countries that might have implemented environmental surveillance. Here, just to mention some of the indicators which might give us a warning as to changes that have to do with new variants of potential interest and concern, which would be increase or departure from the trend as far as the number of cases or the number of cases in specific cases, as well as cases among health and care workers, case fatality ratio, age, disaggregated deaths, hospitalizations, ICU admissions, or bed occupancy rate, and positivity rates. Lastly, we may see a chart here, a table where we documented this information. You can see here the main surveillance objectives on top, and to the left, the various contexts where you can obtain the information. With this table, what we wanted to highlight is that by way of sentinel surveillance, we may attain 3 of these 4 main or core objectives. Therefore, we go back to highlighting the message that it is indeed important to bolster this surveillance system, which has been implemented in many countries to monitor morbidity and mortality, as well as the capability of the healthcare system and integrate genomic surveillance. But in order to have early warning and detection, we will require other information systems, as well as other information sources that will have to triangulate, as we said initially, in order for this to be sufficiently sensitive, and the necessary timely research will have to be conducted to be specific in the least time possible. As regards enhanced surveillance, as we call it, for those countries that have this capacity, as I said initially, this would be the main objectives. However, some of the examples which are provided in this guide to understand which type of studies may support this type of intensified surveillance. This would be special studies of the prevalence of COVID-19 or such studies that have to do with the early warning protocols, such as the first cases associated to a given event, studies of inter-domicile transmission, as well as risk assessment in healthcare workers. But there are also other sources of information that those countries having the necessary capacity would be recommended they should implement as well, such as the clinical metadata that will allow us to make more specific assessment of the clinical dimensions of disease, seroprevalence surveys, very important too, as well as the studies of effectiveness and the impact of vaccine, the surveillance of reinfection, and also the participatory surveillance or self-reporting with various types of platforms. Going to the home stretch, we will now see which are the variables and the information which is recommended for countries to obtain. These variables is subdivided in 3 dimensions. On one hand, those time to transmission, then seriousness, and finally impact. With regard to transmission, very important, and we have highlighted this throughout our presentation. We would have the acute respiratory infection, SARI, pneumonia, among others, to assess the trends using the GISRS networks, as well as the national influenza centers. It is also important to take into account the various sampling strategies. Here we see, and this is highlighted in yellow, that which we may implement by way of the sentinel surveillance with a positivity percentage, and how this genomic surveillance that should be geographically representative of the population. Through the sentinel surveillance, we could monitor as well infection among healthcare workers, as well as cases of reinfection. And we would still have pending, as we said earlier, the surveillance in the interface human-animal, as well as the surveillance that has to do with the domestic environment to see what is the influence of SARS-2, but also, and this would include sentinel surveillance and other types of surveillance that have to do with this human-animal interface. As regards
Quanto à gravidade, isso é muito importante, é algo que aprendemos com a consulta dos especialistas, é uma dimensão muito importante que temos que ser capazes de monitorar e, portanto, recomendamos que sempre se monitorem os ingressos hospitalares para tratamento dos pacientes por Covid-19 e avaliar os níveis de gravidade e as percentagens de admissões nos hospitais. E também é importante conhecer a vacinação dos hospitalizados e as taxas de fatalidade nessas hospitalizações e admissões nos centros de tratamento intensivo, ou CTIs. E, finalmente, como os recursos de saúde, que incluem ocupação de leitos, mas também a oradora está desaparecendo, está congelando na internet. Intérprete pede desculpas. Desapareceu. O indicador
excess of mortality for several reasons, including COVID-19, for which we must use various registration patterns that are not connected to sentinel surveillance. And lastly, we will be reviewing which would be the reporting COVID-19 surveillance requirements required by WHO and international health regulations. Updated interim guidance and public health surveillance for COVID-19. It is requested that member states report daily counts of cases and deaths and weekly aggregate counts. In the case of PAHO, the proposal we're now making for this transition, as I said earlier, where we may integrate many of the objectives of the surveillance into the sentinel surveillance, for those countries that have a sentinel surveillance already, which includes and has included these elements, if they're capable of notifying all the variables that we will be mentioning later, which are shown in yellow, we encourage countries to notify through this route. But for those countries where, because of sentinel surveillance, if this is not sufficiently strong or has not been implemented, and that therefore they cannot provide this information through this pathway, then for these countries, the requirement will be that they continue on notifying the information through the channels that are being used today, such as nominal listings, as well as the Excel aggregate template, weekly template that we will be sharing with you later on. My apologies for showing all these variables in an aggregate manner. We would have confirmed cases, probable cases, confirmed deaths, probable deaths, new admissions to hospital COVID-19 treatment, new admissions to ICU for COVID, health and care workers infected, And all these cases have been distributed by gender also. What are the following steps from PAHO? One of the initiatives that has come up and which has been seen as a true need after the consultations meeting is to assess the severity of the disease by SARS-CoV-2 and all information had to do with
Can you hear
hospital,
me? Can you
ICU,
hear?
admission, vaccination
Levando
status,
em
and
conta
final
esse
outcome
estado e
of
quando
the
conclui
episode
o
which are
episódio.
needed.
Aqui
Here you
podemos
see the
ver
indicators which are being
os
proposed as far as
indicadores
severity is
e os
concerned,
que
and that
estamos
we're
trabalhando,
working as
que
a
é
hub in
a
order to be able
criação
to
de
conduct this
OVR para
assessment of
não só o
severity, not only for SARS-CoV-2,
SARS-CoV-2,
but
mas
also
outros
for
vírus
OVR
respiratórios,
and
e
other
estará centrado na informação
respiratory
visualizada
diseases,
dos
this would have to
casos
do
de
with
infecções
SARI
respiratórias
cases.
graves.
As far as I'm
Esta é
concerned,
toda
this
a minha
is all I have to
apresentação,
say.
não
Just
tenho
to
mais nada a
thank you all for
acrescentar,
your
só me resta
presence here today,
agradecer por sua
and I
participação
will
no dia de
be
hoje.
ready to respond to any questions or comments you may wish to
Ela
make regarding
está
my
congelando
presentation.
e,
And of course, any
evidentemente,
of my colleagues who are
aqueles que estão
connected
conectados
also will give us
poderão
support in
também
this regard.
contribuir.
I
Muito
thank you all.
obrigado. Nós
Thank
que
you so very
agradecemos
much,
pela
Lilia,
apresentação
for your presentation, which is
bastante
very
detalhada,
detailed
muita
with a
informação,
tremendous amount of
evidentemente,
information.
e
We hope
esperamos
that
que
this will
todos
be
tenham podido
digested
digerir.
by
Temos
everyone.
algumas perguntas
We
no
have some
chat
questions in the chat that I
que
will now read out.
vamos
Let me say once
ouvir
again that we have a
em
small
seguida.
audience this morning. We know that we're indeed dealing with different public issues at this point in time, and the
O
time is a
orador
limiting factor.
está
This is
desaparecendo.
why it's important to also
A conexão
share
está
this
horrível
recording,
hoje, não sei porquê.
getting it from our
A conexão
office.
com o Zoom
Let
está
us begin
horrível.
with the first questions. We
A
have,
intérprete pede
remember
desculpas.
that we have
Primeira
simultaneous
pergunta,
interpretation into all
a
4
tradução
languages.
nos 4 idiomas. Bem, há
There's
5
3
ou
questions, 5 comments
3
in the chat,
perguntas no chat
but truly these are
relacionadas
related
à
to
logística
logistic aspects
e
and other issues
problemas
as far
de
as the
interpretação
interpretation of
simultânea.
information is concerned. I will open up the space. You can
Oh
raise your
my
hands.
God.
I see that
Okay.
there are colleagues from the
This
Caribbean, basically, who are requesting the floor. If you want to raise your hands and ask any questions and place it in the chat, please go ahead. Also, our colleagues from PAHO that may have any comments or questions to make, this is the right moment to do so.
No se ve ninguna pregunta.
It seems that we have no questions or comments. Perhaps someone wants to say something. Otherwise, we could continue working by email directly with our office in case there are any questions. I think that the presentation has been quite clear as how to proceed in this regard. Is this agreeable to you, Lilia? Otherwise, I would move to Andrea for him to close the seminar. Oh, I may want to say some, I understand the last issue sometimes causes greater misgivings and doubts, and we get questions from the countries to the questions and information I presented earlier. Vis-a-vis any question, do not doubt contacting us. We can, of course, consider the case of each and every country to see how the various information sources that you have at this point in time may be adapted for the requirements we're now setting forth, and in order to strengthen the Sentinel surveillance, which we have realized plays an essential role in this transition. Excellent, Lilia. So we can leave the seminar at this point. Andrea, I think your camera is on if you want to conclude, and thank you all. Thank you. Thank you. Thank you so very much, Lilia, Angel, and all members of the team, which has been supporting us in order to carry out this webinar. Of course, there are many issues that we have touched upon, and I hope that you will all be able to digest all this information. All of us, the members of the team, are more than ready and available to support you at the level of the countries, and in order to make necessary adaptations within your context, something which is necessary as part of our work. So thank you so very much indeed for participating in the webinar, and see you soon. Bye-bye.